Yeah, so this is a very interesting and exciting abstract that we have with Guillermo Montalban Bravo, my colleague in leukemia at MD Anderson. And really, we had known for years that patients with chronic myelomonocytic leukemia, or CMML, actually have this extramedullary manifestation. Some of them have this extramedullary manifestation. Well, sometimes they'll present with a rash or leukemic involvement in the skin. First of all, the diagnostic classification of these lesions can be very tricky because, oftentimes they don't actually look like straightforward leukemia cutis. Sometimes you'll see features of CMML involving the skin, and then other times it looks like mature histiocytic proliferations involving the skin. So the thing that we wanted to highlight was, several things. One was the phenotypic variation of this manifestation, and that really all of this is underlying CMML and driven by CMML. And so even if it doesn't look quite malignant, it's still malignant and, shares clonality with the CMML. The other things that we found, very interesting during the course of this study was that when you have CMML involvement in the skin and in extramedullary diseases, there's this epithelial-mesenchymal transition program that's turned on. And then the highlight of this study is really the fact that almost all of these cases with extramedullary manifestations or extramedullary involvement have RAS pathway alterations, including KRAS being the most common and significant one. So again, it seems like the extramedullary manifestation is largely driven by RAS. And to that point, there is another study by Audrey Lastry. She's actually presenting this data later today in the AML session, that actually shows the same thing in AML, where extramedullary manifestation of AML is largely driven by RAS mutations. And this is very, it's very important because at the time we have pan-RAS inhibitors and we can target the RAS pathway. So very important both prognostically, diagnostically, and therapeutically.